Welcome to Complete Health with Dr. Mike Rogers. Today's discussion will be about Alzheimer's. Since September is Alzheimer's Awareness Month, we have brought back our guest physician, Dr. Charles Whitney. Alzheimer's disease strikes an estimated 1 in 9 Americans aged 65 and older. Worldwide projections are 160 million people will develop Alzheimer's by 2050 and is on track to take the lives of over 45 million of the 325 million Americans alive today. With the increased number of baby boomers over 65, this giant wave of patients threaten to bankrupt Medicare, Medicaid, and overwhelm long-term care facilities. Currently, there are no medications to stop, reverse, or prevent this epidemic, and with this in mind, many doctors, such as Dr. Rogers and our guest today, are on the forefront of fighting this disease. With us today is Dr. Charles Whitney. Dr. Whitney is a leading national advocate of bridging the oral systemic gap between dentistry and medicine. He has been published in leading print and online journals. He developed an online course for physicians on vascular disease. Dr. Whitney established his concierge medical practice, Revolutionary Health Services, in 2003. Welcome, Dr. Whitney, and good morning, Dr. Rogers.
Good morning, April. Good morning, Chip. How are you today?
I am doing very well, thank you.
Well, I appreciate the fact that you came on with us again and to discuss this since September is Alzheimer's Awareness Month. What I'd like to do is if we can just kind of go over a little bit of the background on what we talked about the last time, a little bit of the science behind Alzheimer's, and then we can progress into other aspects of it.
That would be great. Yeah, eventually people want to know what can they do about it. We're going to get to that, but just as a big picture, we're talking about dementia. Dementia is loss of memory. And that's what scares most people in life. Of my patients, I mentioned it before, that dementia scares them more than having a heart attack or stroke. So there are two main categories of dementia. One is cardiovascular dementia, which is not our main focus today. It's when the pipes that supply oxygen to the brain get diseased, and it can lead to heart attacks, strokes, but it also can lead to disease in the brain. And the approach to preventing cardiovascular dementia is exactly the same as preventing heart attacks and strokes. So what we're going to focus on today is the other 80% causes of dementia of Alzheimer's disease. And that is simply degeneration of the brain, wearing down of the brain, loss of brain tissue. Literally, if you look at imaging, you see loss of brain mass in the brain on an MRI. So that's what we're going to talk about today.
Okay.
And the three categories of it are inflammation, nutrient and hormonal support, and then toxicities.
Now, can there also be combinations of them that create Alzheimer's or dementia as well?
Oh, certainly. Yeah. It's if you have cardiovascular disease, risk for heart attack, or have had a heart attack, then you're likely on the path down cardiovascular dementia. But will it ever cause a problem? Well, we're not really sure. But you get a twofer if you're treating your cardiovascular disease effectively by reducing your risk of memory problems from that category. But you can definitely have a combination of the two.
Now, where we discussed last time some of the basic premise that there's amyloid beta that is the telltale sign for Alzheimer's. Is there any information on that our listeners can listen to or understand on where that all comes from and where it develops? And there's interesting things on this that I find with all the research I've done on it is that amyloid beta is actually a protective mechanism by our brain.
Yes, it is. So beta amyloid is I like to describe that as the goo. That's the goo that destroys our circuitry in our brain. Our brain is one mass of electrical circuit that interconnect. And just like if you were to spill a soda on your computer, you would gum up your motherboard and it would destroy your computer. Same thing happens when beta amyloid gums up the circuitry in our brain. So yeah, beta amyloid is actually a protective mechanism to protect us against the inflammatory processes that go in the brain. Inflammation is a word most of us have heard about, and inflammation is thought of as a bad word, but it's actually a protective on how we kill the invaders of our body, the enemies, the infections, the cancer cells, things like that in the brain, and we use inflammation to protect us against that. And beta amyloid is produced in the brain in response to inflammation of the brain, which is the first of the three categories that contribute to Alzheimer's and what we can address.
Are there ways that we can prevent this inflammation from our brain? I know there are not just one pill that could help decrease this or reverse Alzheimer's, but what about what actually is a way to start addressing this inflammation that can cause that? And then also we can go into some of the nutrients and the toxicity issues as we progress through our show today.
Sure. So inflammation is a human protective mechanism, but it's a human protective mechanism gone bad. If we have what's called chronic inflammation, meaning it never turns off, we have ongoing inflammation that our body, it's a dysfunctional response to a normal mechanism, dysfunctional response. So we have to look at ways to reduce the production of beta amyloid, and then ways give our body a chance to rid ourselves of the beta amyloid. So what I mean by that is it transitions us into what are the causes of inflammation of the brain. So the first one that we're going to talk about is basically diabetes. Diabetes is when you have high levels of blood sugar, but the main problem we have with diabetes in the adult onset type 2 diabetes you hear about is high levels of insulin. That's the high levels of insulin are being produced by your body to keep the blood sugar down. So that's where the problem is that there's actually a nickname for dementia that people may have heard of. There are now some experts calling it type 3 diabetes because dementia is so closely tied to diabetes. It's so common in diabetics. Alzheimer's disease is that there's a tight connection, so they're nicknaming it type 3 diabetes.
That's interesting, Chip, because with all that we're going through, diabetes seems to be one of the biggest or the most profound disease that we have to combat, because that can increase our risk of now Alzheimer's. It can increase our risk of heart attack, stroke. It seems like it's at the basis of everything.
It really is. It is if you want to look for one root cause to get rid of, and as we talked last time, the holes in the roof to patch to prevent Alzheimer's, it's diabetes. And I want to actually make a comment. It's not just diabetes. There's a term people may have heard of called prediabetes. It's a statistical definition, but it means that you've got the process going. It just hasn't gotten bad enough to be defined as diabetes. But I would recommend that anybody out there with pre-diabetes, listen with the same ears, or if you've got a family history of diabetes, listen with the same ears that those out there who have diabetes do, because I'm convinced that the disease process begins years and decades before a person is formally diagnosed with diabetes.
Okay.
You're listening to Complete Health with Dr. Mike Rogers and our special guest, Dr. Charles Whitney. When we come back, we'll discuss how the mouth relates to Alzheimer's. Do you snore? Has your spouse told you they have seen you stop breathing while you sleep? Did you know that sleep apnea leads to many medical problems such as heart attack, stroke, diabetes, and even cause death? At Complete Health Dentistry of NEPA, we screen all of our patients for this hidden danger while you sleep. If your screening indicates an airway problem, we can work along with your physician to get you the help you need. If you have already been diagnosed with sleep apnea and can't or are unable to wear your CPAP, Dr. Rogers can help as well. Don't go another night without this life-saving help. Call Dr. Rogers at 253-5000 to schedule your appointment.
Complete Health Dentistry, transforming your health for a lifetime.
Welcome back to Complete Health with Dr. Mike Rogers. Dr. Whitney, can you explain a little more about this beta amyloid?
Sure. So beta amyloid, think of it as goo. It's a gummy, thick. It's a protein actually, that develops in the brain in response to inflammation. Our body fights off inflammation in certain ways, and in the brain it does so by producing beta amyloid. So what we need to do, because we all have some inflammation develop, but what we want to do is to have the body, after it's producing beta amyloid to fight the inflammation, it has to get rid of that beta amyloid. Otherwise, that's what causes brain disease.
Okay.
Now, Chip, the interesting thing we were just discussing in our previous section about diabetes and Alzheimer's. And one thing that I've come across is that something that takes care of the insulin in our for diabetics is also the same thing that would help with the beta amyloid production and clearing that from our brain. Can you go into a little bit of that?
Yes, it's a very interesting phenomenon, in that one of the reasons that diabetes is so closely tied to Alzheimer's disease is because it's a double hit on the brain. So when you have high levels of insulin, which is what occurs in adults with diabetes, adult onset type 2 diabetes, you've got high levels of insulin are one of the contributors to inflammation of the brain. So you get extra beta amyloid produced in the brain when you have insulin resistance. The double whammy is that the enzyme that breaks down those high level of insulin is called insulin degrading enzyme, very practically spoken. It breaks down the insulin to high levels. It also breaks down beta amyloid. So the same enzyme works on both. So if a person has high levels of insulin circulating, the body is diverted over into addressing those high levels of insulin, and there's less enzyme to break down the beta amyloid in the brain. So you don't only have an increased buildup of beta amyloid, you have a reduced breakdown of beta amyloid in the brain, which is why we believe that there's such a close tie to high levels of insulin, which is why I think we need to address prediabetes, which typically begins 10 to 20 years before a person's formally diagnosed with diabetes.
So its focus is taking care of the insulin levels, and as a side effect, it minimizes the amount of beta amyloid. But if we're overrun with insulin running through our bodies because of diabetes or prediabetes or insulin resistance, now you're on that path to increasing the levels of the beta amyloid in your brain and potentially heading towards Alzheimer's.
Right. That's why I believe that of all the 36 holes in the roof that we work on to prevent Alzheimer's, if there was one that's most important, I would put it as insulin resistance, that mechanism that leads to prediabetes.
Okay. Now, you touched on this 36 holes a couple times. Can you give me a little bit brief synopsis of that and give me some ideas on how all of this relates to, say, dentistry?
Well, in his book, End of Alzheimer's by Dale Bredesen, he describes 36 holes in the roof. Alzheimer's isn't caused by any one leaky hole in the roof. It's caused by 36 different contributors. Some people have 33 active out of 36. Other people may have one or two. But the more you can identify and address, the better off you'd be. And the reason we're having this discussion on your show is there's a lot that you are able to do for your patients to patch some of those holes in the roof. Just tying into the diabetes we just finished, there are two ways that the dental teams can help out, because if somebody has insulin resistance, has diabetes, that they're less able to treat periodontal disease. And if a person has periodontal disease, they are less able to control their diabetes.
Yes. Yeah, we
talked about it also that the periodontal disease by itself is a contributor to inflammation. The insulin resistance is, but the two other contributors to inflammation of the brain, holes in the roof, is when the bacteria from the lower intestine, called leaky gut, get into the bloodstream, spray everywhere, and some of those bacteria land in the brain and drive inflammation and disease. The body's trying to get rid of those bacteria from the lower intestine through that inflammation beta amyloid process. But the same thing occurs in the mouth. When the bacteria from the mouth get in the bloodstream, spray everywhere, land in the brain, the body also, just like it's trying to fight off the periodontal disease with inflammation causing bleeding gums, it's causing that same inflammation in the brain and adding to the beta amyloid in the brain. And if a person can get with their dental teams and reduce their periodontal disease, they're going to potentially improve their blood sugar control and reduce the bacteria going to their brain.
Okay. So in addressing, like we talk on a show all the time, how we test for oral bacteria, because I know there's bacteria that's been found in the brain, and which is difficult to cross the brain barrier, correct? For things to cross into the brain, it's very difficult. It's a protective mechanism.
Some things it's difficult, but they've definitely identified certain bacteria from the mouth that get into the brain. There was a study that I described in our last episode where this researcher discovered, trying to prove that Lyme disease, the bacteria that causes Lyme disease is contributing to Alzheimer's disease. She discovered that it was actually a similar bacteria from the mouth that was getting into the brain.
Right.
And causing Alzheimer's disease.
And a cool thing we have available to us now in our office is we can actually test for these bacteria. It's called an oral DNA test. Very simple, very quick and easy. And it gives us a list on how susceptible or how many of these bacteria you have in your mouth. And, it's as you were just saying, it's not just the bacteria itself causing it, but it's the inflammation that it produces within the body. What else can contribute along with periodontal disease that we can treat in our office?
Well, sleep apnea. Sleep apnea is a big one. Sleep apnea, oxygen is arguably the most important nutrient for our brain. And if you're not breathing for several minutes or hours every night, over the course of time, you're going to basically suffocate the cells of your brain. So, and then the other problem with sleep apnea, it also has a double effect that sleep apnea increases your blood sugar. It makes you more insulin resistant. So not only will treating sleep apnea give you more oxygen in your brain, it'll also improve your blood sugar control.
Right. And I worry about patients. I had 2 this week that had come in and said they were suggested by their physician to have a sleep test done, and I counseled them on getting it done because of all of these issues. One of the things they're all worried about is being put on a CPAP, but one of the things that we have in dentistry, we can make them an oral appliance to help them open the airway and breathe better while they sleep, so they wouldn't be tethered to a CPAP.
I encourage a lot of my patients to do that as opposed to CPAP, because CPAP is treating the effect, meaning it's shoving oxygen into your lungs despite you're not breathing. But what you do in your practice is by opening up the airway through appliances and sometimes orthodontics in adults, you're going to improve the size of the airway, and you're treating the cause of sleep apnea, the tongue being in the way and a small airway, whereas CPAP is just treating the effect. So in many people, it's the preferred treatment.
You're listening to Complete Health with Dr. Mike Rogers and our special guest, Dr. Chip Whitney. When we come back, we will continue our discussion.
Complete Health Dentistry.
Healthy teeth and gums for a lifetime? How important is it? At Complete Health Dentistry of Northeastern Pennsylvania, that is our focus. If your mouth isn't healthy, your body can be affected as well. Gum disease has been linked to heart attacks, strokes, and diabetes. And if your teeth and gums are in bad shape, it affects your ability to smile, eat, and live life to the fullest. You've worked hard. Isn't it time to take care of yourself? Turn to Dr. Michael Rogers at Complete Health Dentistry, where you and your health are our #1 focus. Take time for your health. Call Complete Health Dentistry at 253-5000 and schedule your new patient experience today. See how we can help you feel and look better than you ever thought possible.
Complete Health Dentistry. Transforming your health for a lifetime.
Visit us on the web at CompleteHealthDentistry.NEPA.com.
Welcome back to Complete Health with Dr. Mike Rogers and our special guest, Dr. Chip Whitney.
Chip, earlier we discussed that there's 3 causes for Alzheimer's. 1, we discussed inflammation. 2, we started on nutrients such as oxygen. Are there other nutrients that we need to look at? And then third, we'll go into toxicity issues.
Sure. So in Dr. Bredesen's book, he describes that our neurons are regenerating all the time. And in order to grow good, healthy neuron cells in the brain, we need support of nutrients and we need support of hormones. And he lists in the book, and people can read the book for the details, there are several nutrients that we need to grow healthy, plump, functional brain cells. I believe oxygen is the most important nutrient. There's B vitamins, there's vitamin D, there's a whole list of nutrient support that we need to have, and you can actually measure to see that they're adequate. But one that people don't really recognize is that one of the, apparently as science is revealing, more important nutrients is actually cholesterol. The bad boy, since back in the 70s and 80s, we were saying how bad cholesterol was for you. Well, now we're discovering that plump, healthy, juicy, large cholesterol particles are very supportive and necessary for brain functioning. And actually having low levels of cholesterol might actually be detrimental to your health. So we're seeing that in older people over age 85, the higher the cholesterol, the lower their dementia, the less their dementia. People who are on statin medications over age 85 have more death and dementia than those who are not on statins. So we have this dichotomy of the cardiologists, rightly so, say that statin medications reduce heart attacks and strokes, but and they want everybody to take it in high doses. And the neurologists are saying that the stuff should be banned because we need our cholesterol to support our brain and prevent dementia. So there is no patent answer on what we do about cholesterol treatment because cholesterol is a very important nutrient.
That's interesting. That's really interesting. Is there a way to help with the statin effects of cholesterol in a younger age so it doesn't produce or contribute to the Alzheimer's in the future?
Well, really, the main part about statins is that if a person dies of a heart attack, they're not going to be old enough to get dementia. So I've got a lot of people in my practice on statins, but what I'm doing is I'm reducing doses and making sure a person really needs to be on the medication. That's going to take a discussion with their physician. The other supportive nutrient for our brain is hormone support. And I'm not going to get into the detail because it's very complex, but we need adequate thyroid hormone functioning, we need insulin hormone functioning, we need adrenal hormones, and we need the sex hormones to all be integrating well and working well. And deficiencies in them can potentially lead toward there are holes in the roof that Dr. Bredesen talks about too.
And that's interesting. Once again, that kind of goes back to sleep issues, where sleep issues affect hormone levels overall in your body as well.
Yeah, the adrenals. I mean, if you're suffocating all night long, that adrenaline, adrenal system, adrenal is adrenaline. The adrenaline is firing all night long. You're not getting the rest you need. You're getting too much adrenaline, and that can be damaging to a lot of the human systems.
Interesting. Now, to touch base a little bit on toxicity, where do you go from there with toxicity, and what kind of toxicity are we talking about?
Well, there are different categories of toxicities. One simple one is the pesticides, where the bug killers of the world, whether it's a DEET-filled deep woods off bug spray that you're putting on to prevent bug bites. That's a toxicity to your body that can be damaging to human organ systems. Or heavy metals, such as in your world, mercury is one of the heavy metals that can be damaging.
I know we're heading out of time, and I kind of wanted to wrap up Alzheimer's here, give you the opportunity to talk a little bit more on what can we do to reverse it and protect ourselves or prevent this from coming down to us.
Yeah, that's the million-dollar question that we know that drugs don't work. So I would encourage anyone who has a family history of dementia, anybody who has maybe some of those senior moments, they're wondering if I should be concerned or not, read Dr. Bredesen's book, End of Alzheimer's. It really goes over all of the 36 holes in the roof that we've been touching on in a lot of detail. Go to your doctor and ask for some of the testing that he talks about in the book to see if you're deficient in any of these nutrients or if you have a thyroid issue or whatever. And go to your dentist. I mean, yes, go to the physician. We think about that, and potentially go to a physician who understands this concept and is more understanding of root causes of this and open-minded to it. But go talk to your dentist too, because there's a lot of the holes in the roof, as we've been discussing in this interview, that the dentist can take care of, whether it's periodontal disease, whether it's oxygen at night through sleep apnea, identifying if you have sleep apnea. There are lots of people who have sleep apnea and have no idea. I mean,
Right.
you don't have to be a snorer to have sleep apnea. There's a lot of people who don't snore much, but they do have sleep apnea. And there's ways the dentist can find clues for it. And then take a look at the toxicities. I mean, all the simple ones are eat organic foods as much as you can afford, because they don't have the bug sprays on there. They've got GMO free, where they have good strong antioxidants, and avoid bug spray on your skin as much as you can. Those are some simple ways. And then you mentioned on the fillings before. Talk to your dentist about should you have it done. I mean, I kind of know, but everybody needs to be treated as individual. You don't need to treat all 36 holes. You need to treat the holes that you have. But if you've got a family history or concerns, I'd be more suggesting towards maybe getting the mercury out in a safe way, like Dr. Rogers was talking about. And if you're younger, no family history, doing pretty well, and your fillings are in good order, don't mess with success.
Yeah. Chip, one other thing, is there a specific diet or things? I know you said eat organic, like say a Mediterranean diet or something like that we can head towards that would increase nutrients and help us live longer. I mean, one of the things of mercury is like a Mediterranean diet has a large amount of fish. Fish also contains mercury. Is that an issue that we need to look at?
Yeah, we could have a whole 2 more shows on nutrition alone. But yeah, that's a huge. I mean, if you read the book, multiple holes on the roof involved, and treatments of the holes are involved in nutrition. So yeah, having what type of nutrition is an individual thing. Minimizing carbohydrates. Fats are not your enemy. Your brain needs fats. Make them healthy fats, like in the Mediterranean diet. And if you're going to eat fish, and you can and try to eat as much of the wild type salmon that you have, for instance, as opposed to farm raised, which they have more mercury. The deep sea type salmon is better off. So yeah, there are lots and lots of nutrition approaches, but the more you can educate yourself on what's healthy, like I said before, it doesn't have to be done all at once. It can be, the younger you start, the sooner you make changes, the more impact that you can have on life. But it just really, everyone should understand it's never too late. Dr. Rogers mentioned about potentially reversing. Well, in this Dr. Bredesen recode method that he talks about in his book, there are physicians around the country doing that, and they are starting to see people who are very aggressive with it. There is some potential for reversing. It's not in the science books yet, because it's an early and it takes a comprehensive approach, but in an untreatable disease like Alzheimer's, once it sets up really bad, you really got to work at it. It's one that you got to prevent the untreatable, and Alzheimer's is one of them.
We're out of time today. Thank you so much, Dr. Whitney, for joining us today.
Thank you, Chip.
You're listening to
pleasure.
Complete Health with Dr. Mike Rogers. For more information on this devastating disease, or to have your plaque and oral health checked, call us today at 570-253-5000.
Complete Health Dentistry, transforming your health for a lifetime.
This is Dr. Mike Rogers from Complete Health Dentistry of NEPA. You can listen to this episode again, along with all the episodes of Complete Health, by going online to CompleteHealthDentistryOfNEPA.com. We've covered topics such as sleep apnea, diabetes, children's growth and development, women's health, and more. Listen anytime online. Just go to CompleteHealthDentistryOfNEPA.com or call us to set an appointment, 570-253-5000.
Complete Health Dentistry.